Are you looking for an internet talk radio station for your podcast? Look no further. At the helm of Passionate World Talk Radio are two women that want to provide a spot for you and your podcast to be heard. There are many other places for your podcast, but PWTR has the audience. You will not be disappointed. Our station has been on the internet for the past 16 years. Call us for more information. 484-364-1032 or text Jeannie White, station manager at THECONNECTSHOW@gmail.com for podcast show details. Welcome to Passionate World Talk Radio. Educate, enlighten, entertain.
Hi, everybody. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate World Talk Radio, where our mantra is to educate, enlighten, entertain. The views of the guest may not represent those of the host of the station. Folks, I am beyond the moon excited because I have two wonderful guests with me today talking about a subject that's near and dear to my heart. You need to listen to this podcast, and I'm going to tell you why. Does diabetes run in your family? Do you know what diabetes is and the complications? Do you want to learn how to control it? Not only do you need to listen to my two guests, you need to buy this book. I'm going to tell you the name of the book, and I'm going to tell you about my guests. The name of the book is Conquered Your Diabetes, Prevention, Control, Remission. The authors are, I have with me today, Dr. Martin Abrahamson, Associate Professor of Medicine at the Harvard Medical School and previous Chief Medical Officer at Joslin Diabetes Center. He lectures globally on diabetes and has spearheaded educational initiatives on diabetes for physicians around the world. Also, my guest, Sanjeev Chopra, is a professor of medicine and served as the faculty dean for continuing education at Harvard Medical School for 12 years. He is the recipient of many prestigious teaching awards, a best-selling author, and sought-after inspirational speaker, lecturing internationally. And Dr. Chopra's brother is Dr. Deepak Chopra, who does a foreword at the beginning of this book. Welcome, Dr. Abrahamson.
Thank you very much. Yeah, delightful having us on the program.
Oh, well, it is my pleasure and such an honor. I will have to say, as a former licensed practical nurse, this book is so intense, so educational, so informative. I've been telling people about it already. If they're diabetic, to go get this book because it is just phenomenal. And I have to ask you both, why did you write this book? What motivated you to write this book, which I'm very thankful that you did. Go ahead.
Whoever wants to go first. I'll go first.
Sure.
Martin Abrahamson and I are colleagues for more than a quarter century. We are like brothers, and we teach continuing medical education courses throughout the country. In Boston and Santa Fe, we actually direct a course called Diabetes and Its Complications every year under the aegis of Harvard Medical School. We've also taught in many other countries, including Kuwait, Singapore, Argentina, Greece, and so on. And the mantra we use, and the one we share with our brilliant faculty, is that when you give a lecture, you need to address 3 I's. We need to inform the audience. That, of course, you can do. You're world-renowned faculty at Harvard Medical School or Johns Hopkins or UCLA. That you're going to do naturally. But you also need to inspire. And the 3rd I is that the person reading the book or the person listening to the lecture can then integrate their new found knowledge and incorporate it into their clinical practice. Here, for the reader, it will be to incorporate the lessons into their life in order to flourish in life, in order to have a full and rewarding life. And the disease, whether it's diabetes or chronic liver disease, does not define a person. It's the way we react to it. And if we make up our mind, we can do anything. You know, we can reach the stars, and that's why we chose the term conquer. And then we found an individual who, with type 1 diabetes, some 20 years ago, climbed Mount Everest. There was no continuous glucose monitoring. He had to test his blood sugar repeatedly and adjust his insulin. Then he scaled the highest peaks in all the continents, and then he did a trip to the North and the South Pole, 600 miles. How inspirational is that? And
that's
hence the
very
term, conquer your diabetes. And then we start in the preface, you've probably seen it, a quote by Sir Edmund Hillary, the first person to climb the tallest mountain in the world, Mount Everest, 29,072 feet, together with the Sherpa Tenzing Norgay. And he once said, it is not the mountain that we conquer, but ourselves. Right? What a beautiful
I like
quote.
that.
If we can conquer our doubts, our fears, we can achieve anything. So diabetes has reached such global epidemic proportions. Together with prediabetes, 1 billion people in the world have either diabetes or prediabetes. And there have been amazing advances, understanding of the wonderful new medications that also have, you know, wonderful serendipitous benefits, continuous glucose monitoring, the different insulins, the role of the gut microbiome, a checklist, who should get what vaccines if you have diabetes. And then we also bring in liver disease and bring in the fascinating history of the discovery of insulin now a century ago.
Wow, that is inspiring what you just said.
Yeah, that was terrific. There's not much more I can add to what Sanjeev has said, but I will just say a few things. He talks about the 4 I's, which is inform, inspire, and integrate this knowledge. And I'm going to add a 4th I, and I think that's, again, what it's recapturing what Sanjeev has said, and that's improve. Improve the lives of people with diabetes. The goal of writing this book was to inspire people with diabetes that they can control their disease. The disease doesn't control them. There are a few stories in there of patients who I've seen who came initially to me when they were diagnosed, worried about all the possible complications of diabetes, eyes, kidneys, feet, heart, and so on. And after we sat down and discussed the fact that they can control their diabetes and these things don't have to happen to them, it transformed their lives. And they have actually gone on become really ambassadors in many ways because they spread the word to other people. And our hope is that the people who read this book will not only gain knowledge, because we clearly want them to understand the ramifications of diabetes and what it can do, but we also want them to understand that they can become empowered to take care of themselves, manage their diabetes, control their diabetes, and in so doing, live absolutely normal lives.
Martin, I'd like you to share the story of the amazingly inspiring lady who took all those injections of insulin, had all the complications, including development of celiac disease. And 1 year at our updated internal medicine course, you had her on stage in front of 600 clinicians from 25 countries, and you sort of interviewed her, and then she got a standing ovation. So we tell her story, but tell it briefly now.
Well, it's in pretty much the first chapter of the book, and I think the quote that we have at the beginning of that chapter, attitude is a little thing that makes a big difference, which is a quote from Winston Churchill. really sums up a lot about this person. She was a woman I met when she'd already had type 1 diabetes for almost 65 years. She developed type 1 diabetes when she was 8 years old at the age, in 1937. You can imagine in 1937, insulin had been around, but it was an impure substance. The newer insulins were not developed. There was no blood glucose monitoring. The knowledge, the needles that she needed to inject her insulin had to be sterilized on a boiler on the stove. They were large, huge bore needles that she said required rubbing and waxing her, putting cocoa butter on her buttock before her mother would give her the injection. And she lived at a time and through a time when she actually witnessed major advances in how we manage diabetes, and she embraced every single one of them. Even at the age in her mid to late 80s, when continuous glucose monitoring became available, she was the first person to adopt using it. When there were newer insulins available, she was the first person to adopt it. When insulin delivery systems improved with pen devices and so on, she was the first person to adopt it. She represented the United States in curling. She was an active person. She traveled the world with her husband while he was still alive. He was an aeronautical engineer. She recounted some of the complications that she developed with her diabetes, the eye complications, the osteoporosis that she developed, the story around her developing a condition that is associated with type 1 diabetes, commonly called celiac disease, which Sanjeev knows more about as a gastroenterologist and hepatologist. And she discusses all of these stories together with the fact that when she was first diagnosed, they said to her, "You'll never have children." And she ultimately came to the Joslin Diabetes Center and had 3 children, all of whom were healthy and are healthy. And she lived with type 1 diabetes for 82 years and eventually passed away in her 91st year. But every time I saw her, there was a smile on her face. There was a story to tell me. There was always positive things that she would recount, and never a negative thing came out of her mouth. And when she told her story at our course in medicine, she also gave the story told her story at the American Diabetes Association one year. She got a rousing standing ovation, as Sanjeev says, because people were in absolute awe of what this lady had achieved and her attitude towards her diabetes.
And Martin, you calculated that she received 120,000 injections of insulin during her life that she self-administered. Yeah. Initially her mother, but then later she did.
Yeah. Wow. That is very inspiring. And, of course, in 1957, actually that's the year I was born, to now, many, many advances have been made. My son's friend is a diabetic, and he said to me, "Mom, Nick took out this machine and put it by his shoulder to read his blood sugar." Mm-hmm. So that's new.
Well, Betsy, this is 1937, 20 years before you were born, when she developed diabetes.
Yeah, before any of us were born. Yeah.
Way before we were born. Amazing. But your son's friend is using what we call a continuous glucose monitoring or flash glucose monitoring system. And without having to prick you one's finger, people now are able to monitor their blood sugars 24 hours a day, 7 days a week. And that gives enormous feedback to people as to how they should modify their diet, what they should do with exercise, if they have type 1 or type 2 diabetes. The utility, the usefulness of this is just phenomenal.
That sounds phenomenal. Do they still do back in my day when I worked as a nurse, we used to have to, do their finger prick and test their glucose. Or is that still in existence, or is that done away with and something else has improved?
No, finger stick glucose monitoring is still done. In many hospitals it is still done. because these continuous glucose monitoring systems have not been implemented necessarily in the inpatient setting. There are many people with diabetes where insurance doesn't necessarily cover the cost of these continuous glucose monitoring devices, so the finger stick pricking is still required, but there have been many advances in the finger stick glucose testing in that the amount of blood required and the depth of penetration of these little needles and the sharpness of these little needles makes it almost pain-free, completely pain-free. So there are advances there, but yes, finger stick testing is still necessary for many people. This continuous glucose monitoring is obviously the next step in the advances of glucose testing, which, as I say, don't require necessarily any more finger stick testing unless there's some concern about the validity of the result, which does happen from time to time. And then, of course, for people with type 1 diabetes, we now have insulin pumps that are connected via Bluetooth to these continuous glucose monitors. And these people who use these insulin pumps, who have to have clearly a very deep understanding of their diabetes and food and carbohydrates and so on. But these pumps now can adjust the infusion of what we call the basal amount of insulin based on the glucose concentration. And that actually goes a long way towards improving control, reducing the risk of having low sugars, but still requires the user to give insulin when it's time for a meal and so on. So huge advances, and we cover all of this in various chapters in our book.
Yes, could you please tell the audience, in case they're wondering, well, what's the difference between type 1 and type 2 diabetes?
Sure. Type 1 is what we call an autoimmune disease. It's an unfortunate circumstance where the immune system of one's own body sees the cells of the pancreas that make insulin, the so-called beta cells, as foreign and destroys those cells. So there's it's autoimmune, immune system turning on one's own cells, destroying the cells, making these individuals insulin dependent because they're not making any more insulin as a consequence of this destruction. Type 2 diabetes, which is obviously much more common and affects well over 90 to 95% of people with diabetes, it comes about through a number of ways, one of which is a condition called insulin resistance. Now, what is insulin resistance? That is a term we use to define the fact that insulin is not able to work effectively in the body. And insulin is produced when blood sugars begin to rise, say after a meal, to push the glucose into the cells of the body where the glucose is used to provide energy for the body to function. And individuals who have type 2 diabetes, almost all of them have this condition called insulin resistance, where the insulin is not as effective, can't work as effectively. But in addition to that, their bodies don't make enough insulin. So you have this combination of not enough insulin and insulin not being effective. So as a result of that, the blood sugar levels rise, and then that causes, obviously, the diabetes, which is an elevation in blood sugar.
That's so interesting. How can someone prevent getting diabetes, or can they prevent it, especially if it runs in their family, such as in my case? It's very much so on my father's side, and I am now borderline, keeping my weight down, trying to be active. What else? Like, what can someone do? Because that's from a personal point of view, but I also want the audience to know, what can they do to prevent diabetes?
Yeah, so there are a couple of things we can do, and the first one is lifestyle changes. So eating the right foods, not having artificial sweeteners. A lot of people with diabetes think, oh, I shouldn't add sugar to my coffee, but it's okay to add an artificial sweetener. That actually alters the gut microbiome. We have 100 trillion bacteria in our gut. In aggregate, they weigh 3 pounds. It's been called a newly discovered organ. the inner bacterial rainforest, the second human genome. And it has implications in obesity, diabetes, arthritis, liver disease, autism, Parkinsonism, Alzheimer's, and so on. So eat the right foods. We talk about how we have a whole chapter on diets, something called intermittent fasting, which means if I have my last meal at 6 p.m., I finish my last meal at 6 p.m., then for the next 15 or 16 hours, I don't eat anything. So I don't eat anything, say, till 10 a.m. I can have coffee in the morning, and then in the 8-hour period between 10 and 6 p.m. the next day, I can eat pretty much what I want and how much I want. And people actually lose weight. There are 3 patients with type 2 diabetes. So Martin mentioned that patients with type 1 diabetes universally need insulin for life. There is the promise of stem cells, and there's one patient who's been cured with stem cell therapy for type 1 diabetes by our brilliant colleague, Doug Melton, brilliant Harvard scientist, biologist. But patients with type 1 diabetes usually need insulin for life. Patients with type 2 diabetes are often treated with medications, weight loss, lifestyle, proper diet. Some eventually require insulin. There were 3 patients that we came across who had type 2 diabetes and were on insulin, and with intermittent fasting, they no longer required insulin. One of them had been on insulin for 25 years. So what can we do to prevent? Exercise, eat the right foods, drink coffee. If you drink 4 to 6 cups of regular or decaf coffee, there's a 30 to 40 to 50% reduction in developing type 2 diabetes in men and women. And if somebody already has type 2 diabetes and they drink coffee, 2 cups, 30% reduction in cardiovascular mortality, death from cardiovascular disease. So exercise, eat the right foods, drink coffee. In the future, there'll be ways to change the gut microbiome favorably. Right now, the probiotic industry is a $60 billion industry, but we are still learning what are the benefits. And I think one of the things that will happen in the future is that there'll be precision probiotics. So Betsy, if you're going to take a probiotic, you probably need to take VSL3 and Philips Colon Health, and then we'll analyze the gut microbiota a month later. And if we show that the pro-inflammatory bacteria are down and the anti-inflammatory bacteria are thriving, yeah, you're on the right combination. Right now it's hit and miss. So those are some of the few things we can do to mitigate the risk of developing type 2 diabetes.
Wow, that's interesting.
Betsy,
when you talk about drink, oh, go ahead.
No. Carry on. I'll come back.
When you talk about drinking coffee, do you mean black coffee? Because, people will drink coffee, but they'll put their flavorings in, the sugar in, the milk in.
Yeah, so, I've actually written a book about this topic, and it's called Coffee, the Magical Elixir, Facts That Will Astound and Perk You Up. And it turns out that if you drink coffee, you have a lower risk of 7 common cancers. 7. Head and neck cancer, breast cancer, endometrial cancer, colon cancer, skin cancer, metastatic prostate cancer, and primary liver cancer. Low risk of developing type 2 diabetes, low risk of developing Alzheimer's, cognitive decline, Parkinsonism, gout. It's good for your bones. Lower risk of death from suicide. So if it has all these multitude of effects in a dose-dependent fashion, published in the best peer-reviewed journals, New England Journal of Medicine, Annals of Internal Medicine, the holy grail would be, does coffee lower mortality? Do we live longer? And there are now 5 studies that address that, published in the New England Journal, Annals Diabetology, saying that men and women who drink coffee have lower total and cause-specific mortality. Now, in these studies, when you look at them, there's one study from Europe where 10 countries, more than 500,000 subjects, they all drink their coffee differently. They make it differently. My refrain is, if you have diabetes, you shouldn't be adding sugar. Drink it black. It's easy. After 2 weeks, you won't miss the taste of sugar. It's an acquired taste. The worst thing we can do is add artificial sweeteners. If you add artificial sweeteners, you actually have a higher excursion in the blood sugar. It changes the gut microbiome and makes our blood sugar go up higher. Diet soda has been now shown to have people who consume one diet drink a day for many years. They have a 3 times increased risk of developing heart attacks and stroke. Coca-Cola has seen the writing on the wall. They bought a chain of coffee shops in Europe called Costa for close to $4 billion. Pepsi is coming out with a coffee-infused drink. So the best drink in the world is water, and the second best is coffee. Those are the 2 best drinks. You will actually live longer.
Wow.
So,
Thank you for that information. Go ahead.
I want to get back to the diet issues because Sanjeev mentioned intermittent fasting. And yes, there are people who have reversed their diabetes or gone into remission. We don't talk about reversal, we talk about remission, who have done an intermittent fast. Now, the mechanism whereby that happens most of the time is through weight loss. And what we try to point out in our book is that there's no single one best diet for every single person. There's a lot of books that have been written about this type of diet or that type of diet, and it does this and it does that. And if you actually look at the scientific studies on a lot of these diets, they're successful for a short time, and then there's no more success. Many of the studies follow people for maybe a year or at the most 18 months, and they talk about results, but they don't know what happens after 36 months or 5 years and so on. And so what we try to point out in our book is, yes, there are these different diets, and we explain the different diets. There's low-carb diet, there's very low-carb diet, there's keto diet, there's paleo diet, there's South Beach diet, there's intermittent fasting. But the most important diet for anyone who wants to try to lose weight is essentially a diet that works for them. Obviously, cutting down calories. If you have 500 less calories a day in your diet, generally speaking, you could lose up to 1 pound a week. And we're not talking about lots of weight loss to improve outcomes. If you lose 5 to 10% of your body weight, there's a significant impact on mortality, on glucose control, on risk of other obesity-related complications like osteoarthritis, gallstones, and so on. But the important components of a diet is generally don't have processed carbohydrates, eat whole grains, limit that, have enough protein in your diet so that you don't lose muscle mass, and eat healthy fats. Now, some years ago, the USDA said people must have a low-fat, high-carb diet. And actually, that was the wrong thing, as it turns out, because the low-fat, high-carb diet actually led to increase in obesity. The fats that are not good for you are what we call saturated fats. Those are fats that are found in things like red meat, in butter, cheese, cream, and so on. But the unsaturated fats, monounsaturated or polyunsaturated fats, that are found in foods like nuts and avocados are healthy fats. And as long as you don't have too much of that, because that's got a high caloric content, that's important to have in your diet. In fact, just recently, there was a publication that came out that said people who consumed avocados twice a week exhibited reduced risk, mortality, and cardiovascular disease. So finding the right diet that works for you, that can enable you to sustain it in the long term with sustained weight loss, and not a lot of weight loss. 5 to 10% of weight loss can go a long way towards improving outcomes, can make a huge difference in one's life.
Yeah, Betsy, in a nutshell, the best diet for an individual is the one they can adhere to, which has some scientific backing. That's what Martin was saying. Now, I want to bring up that I'm a liver specialist, hepatologist, that the dominant liver disease in our country right now is called non-alcoholic fatty liver disease. It's also called non-alcoholic steatohepatitis, where in addition to fat, they have inflammation. And it's called non-alcoholic steatohepatitis because under the microscope, it looks just like alcoholic hepatitis. But these individuals are not drinking alcohol, or they're drinking very minimal, negligible amounts of alcohol. What do they have? They have the metabolic syndrome, most of them. They have obesity, type 2 diabetes, they have hypertension, high triglycerides, and they have this liver disease. 70 to 100 million Americans are estimated to have non-alcoholic fatty liver disease. Dominant chronic liver disease in our country. Sadly, we have 3-year-olds with fatty liver, extra fat in the liver. We have 16-year-olds who not only have fatty liver, they have the early warnings of cirrhosis. They have increased liver fibrosis. End-stage cirrhosis with liver failure is due to NASH, NAFLD, is now the number 1 or number 2 indication for liver transplantation in our country. It's so sobering. It's sad. I think we need to address this. This is a public health issue. I sort of saw this coming more than 20 years ago, and together with a sub-intern and a hepatology colleague wrote one of the original review articles in the Annals of Internal Medicine called Non-Alcoholic Steatohepatitis, the Burgeoning Epidemic. I think people that are looked upon with some level of respect and authority, like nurses, like doctors, should be going to elementary schools, middle schools, to the Rotary Club, the Lions Club, to your church, to your synagogue, your temple, your mosque, and giving talks about this. We need to create a greater awareness amongst the public about the importance of being as close as we can to our ideal body weight and doing exercise, eating the right foods, all of that. I think Martin also pointed out something very, very important. That is, if somebody is, 200 pounds overweight, they lose 14 pounds. There can be a huge improvement in many, many metabolic parameters, including blood sugar, including this liver disease. And one of the things that works very well, and we talk about this in the book, is motivational interviewing. And when we do that with patients, they are more often able to lose weight or exercise or quit smoking than with the traditional method of saying, you got to quit smoking, you got to lose weight, you can develop a stroke, you can develop heart disease, you can develop kidney disease, wind up on dialysis. Those fear tactics don't work. But motivational interviewing works, and we have an example of that in the book as well.
Just to add to that,
go ahead.
And to amplify what Sanjeev just said, the whole goal of this book, writing this book, and one of the purposes is to tell the audience, to tell people at risk for diabetes, people who have diabetes, friends, family members of those people who do have diabetes, that small changes can make a big difference. And that you don't have to sort of say, oh my goodness, I have to go and lose 50 pounds of weight, otherwise nothing's going to work anymore and I'm going to be doomed. Because it is a huge ordeal to lose something like 50 pounds of weight when you think about it initially. But if you chip away at it and you change your lifestyle and you lose a little bit of weight and then you lose a little bit more and you get encouraged by your success, then it's amazing what people can accomplish in the long term. One of the stories in the book is about a patient who's a professional and who was being warned by his doctor for many years. You're looking for trouble because you're gaining weight, you're not exercising. And all of a sudden one day he developed typical symptoms of diabetes, which is excessive thirst, excessive urination, blurred vision. He was actually losing a bit of weight because he was just pouring all his glucose out as calories in his urine. And he had a hemoglobin A1C close to 16%. That's phenomenally elevated. A normal hemoglobin A1C, which is a test that we use not only to diagnose diabetes or pre-diabetes, but to monitor people with diabetes, a normal one is 4 to 6%. And as you said, borderline, anything sort of from 5% up is borderline. And he walked into the office and suddenly said, you know what, I've suddenly got the message. I had to start him on insulin because he had such high blood sugars. And he said to me, I promise you that in 3 months' time I'm going to be off insulin. He worked at it. He changed his lifestyle. He began to exercise. He cut out a lot of the calories and the unhealthy carbohydrates from his diet. And literally 3 months later, he was off insulin. He still required some other medications to manage his diabetes. His hemoglobin A1C came down to 6.6% over 6 months and has remained below 7%, which is our goal for most people. In fact, below 6.5% it's been pretty much ever since that time, and that was about 10 years ago. So it can be done. And he takes a few medications. Some of the newer medications he's been started on because they have health benefits that go even beyond glucose lowering. They can facilitate weight loss. They can actually have cardiovascular benefit as well. And he's living an absolutely healthy life now, and he has no complications of diabetes.
Wow, that's amazing. I can't thank you and Dr. Chopra enough for writing this book. I hear your passion. Not only did you write this book, but you wrote it with passion. You both speak with such passion to help people, and I just really admire you both for that. And thank you for doing all of us a service by providing us with this information. I have to ask you to real quick, because I do run a support group for people who are caregivers, and you hear about a correlation with diabetes, vascular dementia, which could lead to, other problems. Is there a correlation between diabetes and dementia?
Unfortunately, there's more and more evidence coming out to sort of supporting the fact that people who have high blood sugars, who aren't controlling their diabetes well, do have a greater risk for the development of cognitive decline, dementia. And you can, if you reduce your glucoses, if you control it well, then that risk is mitigated. But there's also other things that people can do, and Sanjay is going to say something about what other people can do to reduce risk of cognitive decline.
Yeah, so, to reduce cognitive decline, which is early Alzheimer's, and to mitigate the risk of developing Alzheimer's, if one has diabetes, sure, very good blood sugar control will help. But if you don't have diabetes, it turns out there are a few things. And again, it's exercise, physical exercise. The second one is meditation. I wrote a book called The Big Five, and one of the chapters is on meditation. And I tell my friends and colleagues and students, you should meditate once a day. And if you don't have time to do that, you should meditate twice a day. So meditation lowers the risk of development. It's not a religion. There are many different kinds of meditation. They all work. Physical exercise, meditation, drinking coffee, lowers the risk of neurodegenerative disorders, including Alzheimer's, Parkinsonism, and also, interestingly, stroke. And the fourth thing is learning something new. You know, when we grew up, we were told you can't teach an old dog new tricks. Actually, you can. We can all learn something. And we're actually most happy when we're growing, when we're learning. And if you keep playing chess or keep playing Sudoku or doing crossword puzzles, you'll get better at it. But what you need to do to mitigate the risk of Alzheimer's is to learn something new. Ballroom dancing, you know, whatever, a new language. And when you do that, you actually grow neuronal connections in the brain. And this is called neuroplasticity. So physical exercise, control your blood sugar, meditate, learn something new, drink coffee, and we'll be better off.
Oh, thank you. Thank you so much, Dr. Martin Abrahamson and Dr. Sanjeev Chopra, for coming on today, for writing your book, for caring for others. I so appreciate it. I could talk to you both for hours about diabetes and all kinds of topics. Thank you so much. Really appreciate you coming on my show and sharing with my audience your book and your information, which is phenomenal. This is one phenomenal book.
Thank you for inviting us.
Yeah,
You're welcome.
Absolutely. Thank you for inviting us.
I just want to, I also want to just say one other thing, that obviously diet and exercise, lifestyle modification is a key thing here for the prevention of diabetes. It's also key, obviously, to control your diabetes, whether you have type 1 or whether you have type 2 diabetes. If you have type 2 diabetes, there are newer medications that are out that have multiple benefits that can help with weight loss. There's some of them may even help improve some of the fibrosis and scarring in the liver that Sanjeev was talking about with regard to fatty liver disease. They may help that a little bit, but weight loss is the key to improving fatty liver disease. And these newer drugs have cardiovascular benefit. They help people lower the risk of cardiovascular events if they've had a previous event, and in some cases, even if they've never had a cardiovascular event. And cardiovascular disease is the biggest killer in people with diabetes. It's still the number one cause of death throughout the country. So there are these newer medications which are available, and which those of us who are involved in developing guidelines for managing people with diabetes, put them right at the top of the pile in terms of what drugs to be chosen if you need to take medications. So there's so much more that people can do today that they couldn't do in years gone by, that today we should be seeing more and more people achieving glucose levels that are acceptable. And it's our hope that from these stories and with the information, that the reader will be inspired to do just that.
I want to mention one other thing, and that is we
Sure.
have a chapter on bariatric surgery in patients who are significantly obese and have diabetes. And, hopefully you won't get to that stage where you need it. But if there's somebody needs it, it's an amazing operation. It actually increases longevity. It's the one surgical procedure that has been shown to increase longevity in this group of individuals. And patients lose weight. Many of them come off their multiple medications for diabetes, for high blood pressure, high cholesterol. At the end of 2 years, the savings incurred by virtue of that pay for the cost of undergoing bariatric surgery. So it's pretty phenomenal. It is the number one general surgical procedure now in many academic centers. And it harkens back to what I said earlier, that those of us in the nursing profession and the medical profession, there's a call for action. We need to educate young people in elementary schools and middle schools about the importance of not getting significantly overweight, the importance of exercise, not smoking, not drinking alcohol, and flourishing in life. We can do that. The old adage, an ounce of prevention is worth a pound of cure, is so appropriate for this condition.
Yes. Yes,
Yeah.
absolutely.
And there's one other thing.
Sure.
I just want to point in quickly. Sleep. Getting enough sleep.
Good.
Very important. Not only getting enough sleep, but having the right amount of sleep, right type of sleep. And unfortunately, there's another condition that goes along with obesity, insulin resistance, and so on, and that's a condition called sleep apnea. It's underdiagnosed, and there's treatment for it. And if people just treat sleep apnea and get better quality sleep as a result of that, their A1C, their blood sugars can improve because it reduces insulin resistance. So getting enough sleep and the right type of sleep is also another component of just lifestyle modification that's clearly important.
So for individuals who are listening, if they wake up in the morning, maybe they slept 7 or 8 hours and still don't feel they had a refreshing night of sleep, they may or may not snore, they may or may not be significantly overweight, please talk to your primary care physician and ask the question, could I have sleep apnea? And you can do a simple test, you can do sleep studies, and then there are devices you can put on at night. Even if you put them on for 3 or 4 hours, it can make a huge difference in the quality of your life and, as Martin mentioned, in lowering your blood sugar. So very, very important to be aware of all the ramifications related to weight gain and obesity.
Thank you. Is conqueryourdiabetes.com your website, Dr. Abrahamson and Dr. Chopra? Oh, great. Yeah. Okay, so that's going to be in the blog. I would highly recommend the audience to go on conqueryourdiabetes.com, and your book is available, Conquer Your Diabetes, Prevention, Control, Remission, on Amazon.com. You could go to your local bookstore. They will order for you if it's not in. But please, get this book. I highly, highly recommend it. It is just phenomenal. And I can't thank you enough, Dr. Martin Abrahamson and Dr. Sanjeev Chopra, for coming on, writing this book, and doing all that you're doing to help people. A million thank yous to you both.
Thank you so much for having us. Thank you.
Oh, you're welcome. My pleasure. You're welcome. Folks, if you missed any of this podcast, you could catch it wherever you hear your favorite podcast. I'm all over the place, but Speaker, Spotify, Apple, or just a few. And it's free to subscribe to Chatting with Betsy. And you heard my guest today. This is why you need to subscribe to Chatting with Betsy. You'll never know who I'm going to have on. And please share this podcast to help others. If you know anyone who's diabetic, even if you don't, share this podcast. It will definitely help people, and that's what this podcast is about, is helping people. And I want to thank Jeannie White, who's station manager, Passion World Talk Radio, for writing the blog, producing the show. Please read the blog. It will have the website in it and information about our guest. And I want to thank Lillian Caldwell, who's CEO of Passion World Talk Radio, who makes this all possible. And I want to thank Lisa Warren, who is president of Lisa Warren PR, who arranged the interview. And thank you, audience, for listening and sharing. I can't thank you enough. And as I always say, in a world which you could be anything, please be kind. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate World Talk Radio. Bye-bye now.
Are you looking for an internet talk radio station for your podcast? Look no further. At the helm of Passionate World Talk Radio are two women that want to provide a spot for you and your podcast to be heard. There are many other places for your podcast, but PWTR has the audience. You will not be disappointed. Our station has been on the Internet for the past 16 years. Call us for more information. 484-364-1032 or text Jeannie White, station manager, at THECONNECTSHOW@gmail.com for podcast show details. Thank you for listening to Passionate World Talk Radio. You can listen to this program all over again by going over to https://passionateworldtalkradio.com. You can also hear it on Spotify, Spreaker, Amazon Alexa, AMFM247.com every Tuesday evening between 8 and 9 p.m. YouTube, Facebook, Facebook Live, LinkedIn, and all the other podcast directories one can find on the Internet.